Now we'll be doing your left eye.
Glaucoma is the second most common cause of blindness, and it affects over 4 million people in the United States.
And don't blink. Glaucoma is a progressive optic neuropathy that causes the death of retinal ganglion cells to occur at a faster rate than it occurs in a normal, healthy individual.
And it's the death of these cells that causes vision loss or blindness.
Glaucoma is, at the moment, with our given knowledge and given scientific expertise that we have, this is not a reversible cause of blindness. Once the blindness sets in due to glaucoma, it has set in. Okay, blink a few times.
That's why it's very important for everyone to get tested when they visit their eye doctor.
We're done.
But current tests are not 100% effective in diagnosing glaucoma.
Would you like to come forward?
And that is what Dr. Pinakin Gunvant from the Southern College of Optometry is trying to change.
We had reasonable success in a variety of mathematical models, and we were trying to expand on our prior research and perhaps improve upon it.
So to further this work with mathematical models, Dr. Gunvant started Googling engineering schools in Memphis looking for a collaborator.
The rods and cones that connect.
And he came across the work of Dr. Khan Iftikharuddin from the Herv College of Engineering at the U of M.
I was working with St. Jude's on brain tumor research. The problem seemed similar because both the problems here and the other problem that I was working before with St. Jude's, they had this recognition aspect.
What you're seeing right here.
Dr. Khan had used a mathematical technique called fractal analysis to detect statistical differences in several other applications such as facial recognition software, infrared targeting, and brain tumor detection.
Fractal is it's a tool. Now, fractal in general is a chaotic process. And it turns out that even in chaos, we should be able to identify some sort of quantitative measures. In general, if you look at the objects, for example, like coastlines or leaves, like fern leaves and things like that, you'll see the self-repeating patterns in those figures. So that self-repeating pattern is called fractal.
Patch over your left eye.
And in this case, fractal analysis is used to compare data from known glaucoma patients to the test results from new patients to see if they have glaucoma.
We are trying to get to a mathematical model that can globally look at any patient and classify them as perhaps normal or glaucoma.
So the two started to work together to analyze the data from the glaucoma test that Dr. Pinakin was doing. Paul Kim, a PhD student in electrical and computer engineering at the U of M, has been involved with this project since the beginning.
My part is getting a global shape analysis and also local shape analysis on the Excel data sheet so that we can have a better classification performance using fractal based analysis.
And so far, the test results have been promising.
We have analyzed the data set using the standard machine classifier, which is the nerve fiber indicator. And we find that the nerve fiber indicator is about 85% accurate.
Whereas in this case, with the fractal technique, we obtained about 95, 97, which is about 10 to 12% more accurate.
You can blink normally during this test.
A grant from the Assisi Foundation of Memphis that Dr. Gunvant has received helps to care for the patients in this study and to cover the cost of Paul Kim's tuition.
It made me feel that I'm doing something worthy, so it really helped me to be motivated and work harder.
So if you take an example of this eye.
The three researchers have applied for a patent on the process, which they hope will be able to help glaucoma diagnosis worldwide, because early detection is vital.
Once you detect the disease, you could have treatment that could be started to halt the disease where it is, or perhaps decrease its rate of progression.
So this partnership between the U of M and the Southern College of Optometry is working to better diagnose glaucoma to the benefit of patients everywhere. For the University of Memphis, I'm Sarah Blue, Senior Broadcast Journalism major.